Hello everyone. So today we are going to discuss case number 1233 of OBS and gyne. A string of pearls appearance on ultrasound is typically seen in options are alpha ovarian torsion, beta polycystic ovarian syndrome, Charlie ovarian cyst adenoma, or delta endometriosis. I'm going to give you 5 seconds so you can answer this question. Yes, the answer is polycystic ovarian syndrome, option B. So basically, polycystic ovarian syndrome, as you all know, according to Rotterdam criteria of 2023, it has two out of three of the following. If the patient is having oligo or anovulation, and number one, and number two, if the patient is presenting with a sign of hyperandrogenism, that is increased hair growth and acanthosis nigricans, or number three, if the patient is having the ultrasound evidence of polycystic ovaries that include the immature follicles up to 20 follicles that you can see on ultrasound, and these follicles are in the form of string of pearls when you see it on the ultrasound. So this is all the background knowledge of polycystic ovarian syndrome. So let's discuss why this is our answer. Our answer is B, polycystic ovarian syndrome, because as I told you that this is the basic criteria for diagnosing the polycystic ovarian syndrome. So the string of pearls, these are the small follicles that we are actually seeing in the periphery of the ovaries. Which are in the arrested form that are not developing into the mature follicle. That's why the patient is anovulating. So this is it, and let's discuss why not the other options are correct. Our option A was ovarian torsion. Ovarian torsion represent with enlarged ovary, peripheral follicle, and reduced blood supply, not the pearl-like pattern. And number C was ovarian cyst adenoma. It appeared as a large one unilocular or multilocular cyst with thin wall, not peripheral follicle pattern that is typical for PCOS. And endometriosis, in endometriosis we see endometriomas, which is also called as chocolate cyst. So when you see chocolate cyst, this is the endometriosis. And lastly, if we are going to discuss some important key points that will help you in the future. If we see a ground glass appear on the ultrasound, that is endometriosis. Also, the chocolate cyst is also related to the endometriosis, and Whirlpool sign on the Doppler is also indication of ovarian torsion that I already told you, decreased blood supply to ovaries, and large ovaries that we can see. And with Whirlpool sign on Doppler, there's the ovarian torsion. Honeycomb appearance is seen in hydrated cyst, also called as echinocosis, and snowstorm appearance on the ultrasound is typical for molar pregnancy. These are the other topic. I'm going to just give you some um, mm, pearls that you can use in the future MCUs. So I hope this video is helpful for you. Thank you so much for your concentration.